Okay. Autonomy, futility, and the limits of medicine. Bovia versus Supreme Court, lecture number 4. 2 reasons for refusing treatment. Last week we discussed the issue of paternalism. Paternalism has to do with the degree to which it's permissible for doctors and other healthcare workers to make decisions on behalf of patients for their own good. Our first article from Robert Schwartz is a discussion of the right of physicians to refuse treatment to patients who desire that treatment. Schwartz distinguishes between 2 reasons for refusing medical treatment. One is futility. Schwartz thinks it's obvious that physicians don't have to offer treatments which do not work even if the patient wants that treatment. Hence, to use his example, a doctor would not have to prescribe or recommend passiflora tea to a patient with cancer, since there is no evidence that this would help the patient. Another reason for denying treatment concerns the purpose of medicine. Schwartz begins the article with a discussion of someone who wants his arm amputated for religious reasons. Schwartz argues that since doctors are only trained to do procedures which are medically necessary, and since this procedure is not medically necessary, the doctor has the right, perhaps even the duty, to refrain from amputating. It's with this second reason for denying treatment that the article focuses on. The Wangley case. Helga Wangley was an 87-year-old woman who suffered severe brain damage and slipped into persistent vegetative state after suffering a heart attack. In a persistent vegetative state, the patient has no higher order brain function, but can be kept alive through the use of technological help such as feeding tubes and ventilators. Such a person is not technically dead, but she is not at all conscious and does not engage in thinking or perceiving the world or herself. Mrs. Wangley was on a ventilator which breathed for her and was being fed through a feeding tube. After several months of this, the doctors thought that keeping her alive like this was medically inappropriate. They thought that being kept alive this way was no longer a reasonable medical alternative. Nobody has ever regained consciousness from such a deep coma, and the doctors knew that Helga would not either. The Wangley family objected. They viewed removing Helga from the machines as tantamount to murder. They also thought that only God could legitimately make such a decision. Furthermore, they testified that this would have been Helga's view also if she were capable of speaking for herself. Hence, they viewed themselves as the best spokespersons on behalf of Helga. Question 1C asks, in what ways the doctor's desire to remove Helga from the feeding tube would be a violation of her and her family's autonomy? The answer is probably pretty obvious. The family knew what Helga would have wanted because they knew her value system. They also knew she would have wanted to stay connected to the machines. Hence, they were exercising Helga's right to autonomy by insisting the treatment continue, and the doctors were trying to overrule this right because they thought that keeping a person alive in a persistent vegetative state was not a legitimate goal of medicine. What would a utilitarian say about such a case? What arguments could a utilitarian give in favor of ending the treatment? Well, one thing, this treatment was very expensive. Her hospitalization was paid for by Medicare and a private insurance company. Hence, money was taken from the overall pool of money which we reserve by various means to treat people's illnesses. This is one bad consequence of this course of action. Having said that, a utilitarian would also pay close attention to the grief caused to her family if they went against her priorly spoken desires. Hence, it's possible that a utilitarian, especially an act utilitarian, would accept keeping her alive. A rule utilitarian most certainly would not, given the expenses. The court ruled in favor of the Wangley family on the grounds that they were in the best position to carry out whatever wishes Helga had, or would have had, given her overall value system. Schwartz disagrees with the court's decision because he thinks they focused on the wrong issue. Schwartz does not think that patients have the right to treatments which go beyond the purpose of medicine. Notice he doesn't object to the treatment on the grounds that it is futile. This is because the goal of the treatment was simply to keep Helga alive as long as possible, and he was succeeding at that. What this treatment could not accomplish is restoring Helga to even minimal consciousness. Hence, this raises the question of whether the goal of keeping someone alive in a vegetative state should be a goal of medicine. Schwartz answers this question indirectly. He argues that doctors are the ones who are in the best position to determine what is medically appropriate and what treatments fall outside of the scope of medicine. Most doctors care about their patients' well-being, and they know more about what the goal of medicine should be than the average person on the street. Doctors will disagree amongst themselves concerning a variety of issues. Schwartz thinks that this makes his suggestion that doctors should get to decide even more plausible. This is because a treatment will be available to a patient if any doctor they have access to is willing to provide that treatment. If no doctors will provide a treatment, then it's quite likely that the treatment is misguided. Is Schwartz right? Figuring out the goals of medicine is more a question of moral values than it's a question involving specific medical skills. Hence, you might think that the average person on the street is just as capable as the average doctor in determining whether or not a procedure is inappropriate. Then again, you might not. Now we are going to look at patient autonomy and paternalism from the opposite angle. Just as a patient might want a treatment a doctor is unwilling to provide, a patient might want to reject a treatment a doctor wants to force on that patient. Elizabeth Bouvier was in such a situation. She was a 28-year-old woman who suffered from cerebral palsy and was also a quadriplegic. Even though her physical body was in ruins, her mind was sharp. It's worth noting that she was in a lot of pain most of the time, and her family decided that they could not care for her. At the time this brief was written, Elizabeth was at a public hospital in Los Angeles and could not eat enough food, being spoon-fed due to nausea and vomiting. Hence, she was put on a feeding tube against her wishes. She preferred to starve instead of receiving treatment in the form of a feeding tube. This case raises a number of issues. First, does refusing a feeding tube when you can't eat enough food the natural way constitutes an attempt at suicide? You might think it does, since Elizabeth knows that refusing the treatment will result in her starving or perhaps dehydrating to death. If you view her decision in this manner, then you are forced to consider whether or not suicide is ever morally permissible. Do all mentally competent adults have the right to take their lives? Do only those experiencing great suffering have such a right? Or does nobody have such a right, ever? You could also view her decision very differently. You might think it's the disease which is killing her, since it has already prevented her from eating and drinking sufficiently the natural way. Refusing treatment is accepting the fact that the disease will soon end your life. But this is not really suicide since you are not actively killing yourself, but say using poison. This is also a plausible way to view the case. This raises the question, is deliberately letting a disease kill you any different, morally speaking, from actively taking your own life? This question is hard to answer. What do you think? Many persons who have cancer refuse chemotherapy, even when it's likely to extend their lives for a few years. The reason is that chemo is a deadly toxin which ravages the body and causes great pain and suffering. Many cancer patients prefer to let the disease kill them sooner. How does such a patient's decision compare with Bovia's desire to reject her own treatment? Most people don't think that cancer patients who choose this path are committing suicide. What is different, if anything, about Bovia's case? If you think a cancer patient can make a proper choice to reject chemotherapy, must you also think that it's proper for Bovia to resist treatment for similar reasons? Thinking about parallel cases is a great tool for gaining clarity on specific moral issues, as the comparisons often reveal inconsistencies in our initial judgments, which then force us to rethink our views.